people don't understand is our teeth are made out of 97% hydroxyapatite crystals. Okay, so that is what your teeth are made out of. What fluoride supposedly does is it creates fluorapatite, which is a form of hydroxyapatite. But it's also, if you look at where fluorine is on the periodic table, it's a halogen. And in last year, August 24th of 2024, the FDA, they were sued by the Fluoride Action Network and won. And they were able to prove that taking systemic fluoride is a neurotoxin. It reduces the IQ and it's a mutagen. So it really needs to not be in our water supply. So I'm really happy to see that things are kind of moving forward with removing that from our water supply. But we really need to change the paradigm of our thinking. I mean, in 65 years, John, have we not come up with something better than fluoride? Of course we have. It's called Nano hydroxyapatite. My products contain them.
Hello, I'm John Brink, and we are podcasting on the Brink from downtown Prince George, British Columbia, Canada. And for all those people around the world, they say, okay, we know where Canada is, and British Columbia is on the west coast, right? Right. And we have that big city called Vancouver, right? Well, we are 500 miles north of Vancouver, or for our European friends, 800 kilometers. And that puts us in the center of British Columbia, north-south, east-west. Big, big province. And so the city of Prince George, about 82,000 people, and lots of lakes all around us. Within 50 miles, we probably got 100 lakes. And then lots of other friends, black bears, grizzly bears, caribou, deer, foxes, wolves, you name it. We have it all here. We call it paradise. Today's a very special guest. Her name is Heather Paul. Heather is being a dental hygienist for more than 30 years, but her path has been far from just a conventional, as we know, hygienist, but in her early career, she began questioning the traditional industry, and even more appropriate these days, I would think, and challenged the practices, and in particular the overuse of fluorides. And she will tell us all about that. Heather, welcome to the show.
Thanks for having me, John.
So, share with us. You have an amazing career as a dental hygienist, and most people, if we refer to the dentist, I still remember when I was a kid. I turned 84 a couple of weeks ago, and so a couple of months ago actually. And when I went to the dentist, I was born in Holland, and I still remember. Oh my God, that was painful. Oh, the drill was slow, and oh my God, everybody was afraid of a dentist. But dental health, oral health, extremely important, not only for your dentures, but or your mouth and teeth and all of those things around it, but for your whole body. Tell us about your career, going from the beginning to what made you go into becoming a dental hygienist, and obviously then having this long career, and then already questioning what are we doing? Is this the right way to go about it? And how can we change it?
Well, it's such a long story, but I would say it really kind of, well, dental hygiene for me was more of a divine calling. But it wasn't until after I had my twin daughters. One of my little girls was allergic to like 25 different foods. She was always sick, always had something wrong with her. And so through a series of testing, we discovered all these food allergies, and I had to really learn how to read a label. And, I became very proficient at understanding the ingredients in foods, but really wasn't until 2010 that I kind of started looking into oral care products. It just never really dawned on me. And I started researching the ingredients that were in oral care products. And I tell you, John, I was really blown away that they are allowed to put these chemicals in our oral care products. But most people don't know it's because oral care falls into the same category as cosmetics. So that's why, they're allowed to put this stuff in there. But, your mouth is the most vascular part of your whole body. So whatever goes into your mouth is going to get into your bloodstream. So in 2010, I just started, really looking at what was out there and researching on my own, not what I had been conditioned to believe, but doing my own research, which I always encourage everyone to be their own health advocate. Um, so I would go to the health food store and I would even, read the ingredients on some of the products in the health food store. And I was still just blown away that there's still chemicals in there. So I really just started praying and like, God, give me something to help my patients. And honestly, he really just gave me Simply Silver Mouthwash. And here we are 8 years later, and we've expanded our line. But it's just an all natural oral care line that I'm comfortable recommending to people because it's not going to disrupt your oral microbiome. There's no toxins in there. It actually is going to help raise the pH of your saliva and not reduce it. So there's so many benefits to using something that helps support your body instead of stripping away the natural protectants such as our saliva with things like alcohol and even fluoride disrupts the oral microbiome. So that's kind of where we're at now.
So the product that you developed is one that you drink, you wash your mouth. How do you take it? So it's
So
sitting next to. Is it sitting to your right? Maybe
yeah,
show
this
it
is
to us.
this is one of them. It's a colloidal silver base, and um, our mouth has 800 different bacteria, John. It's called our oral microbiome, and it's both good and bad bacteria, right? It's really our mini immune system because our mouth and our gut are related. So if you use products that are wiping out your oral microbiome, that is directly affecting your immune system. And pretty much most of the products, the commercial products out there, disrupt the oral microbiome because they're so acidic. Some of your main brands, when you actually test the pH, they're like a 4.2, which if your saliva drops below a 5.5, that's how you can get decay. So it's extremely acidic, can promote cavities, disrupting your oral microbiome, which is going to dry out your mouth. It exasperates the bad bacteria. So things aren't, the good bacteria isn't really flourishing, which can create more bad breath. And so it's just a very delicate balance that you need to keep inside your mouth because, again, everything starts here. I mean, we can eat clean all we want, we can exercise all we want, but if we have disease in our mouth, we're not healthy. So promoting your oral microbiome with good, healthy products that don't contain toxins is a good place to start.
The interesting part about it, Heather, is that my wife is very proactive and she's a vegetarian, and I always talk about that years and years ago. I didn't listen as well to her as I could and should have. But even now, still after all that time, I'm probably vegan 80-20 or so, 80-10. But and she is very proactive about talking to me about, I don't like the toothpaste that you're using because it has fluoride in it. I said, no, it doesn't, so blah, blah, blah. But I'm going to have to look at it again when I get home and just to make sure she's probably right. And, and so the amazing part about it all is that we see so many advertisements on TV that's saying what you want to get, you meaning in a general sense that buys potentially my products, you want to get healthy teeth and whiter teeth. You can improve the quality of your teeth by 2 grades or whatever they call it, and by using this product. But if you carefully looked at that product, I'm not sure that if you fully understood what is in it, it likely has uh, stuff in it that's not good for you. And
Exactly. Yeah, and well, I think there's this misconception, and we've been programmed into believing that unless you have fluoride, you're not going to have healthy teeth. But
yeah.
what people don't understand is our teeth are made out of 97% hydroxyapatite crystals. Okay, so that is what your teeth are made out of. What fluoride supposedly does is it creates fluorapatite, which is a form of hydroxyapatite, but it's also, if you look at where fluorine is on the periodic table, it's a halogen. And in last year, August 24th of 2024, the FDA, they were sued by the Fluoride Action Network and won. And they were able to prove that taking systemic fluoride is a neurotoxin. It reduces the IQ and it's a mutagen. So it really needs to not be in our water supply. So I'm really happy to see that things are kind of moving forward with removing that from our water supply. But we really need to change the paradigm of our thinking. I mean, in 65 years, John, have we not come up with something better than fluoride? Of course we have. It's called Nano hydroxyapatite. My products contain them, and it's a bioidentical form of hydroxyapatite. And the great thing is you're already getting hydroxyapatite in your own saliva. So it's not harmful. It's not going to cross your blood-brain barrier and create any problems. It's been proven safe and effective. I love the new science that's coming out. It's proving that it does remineralize teeth. It helps eliminate white spots. So when you use something, your body recognizes it. It's called bioidentical. So I think you are starting to see more of a shift into the nanohydroxyapatite side of things. It's just dentistry is very slow in coming around, really, really behind the times in so many aspects. But I really believe that fluoride is hopefully going to go away and be replaced with more natural things. I believe people are wanting more natural products and really starting to understand that there's not like, your mouth is not a compartment, right? I mean, everything in our body is connected. Our teeth are organs, they're linked to other organs. So when you start, looking at your mouth differently, as this is where true health starts, I think it kind of changes your perspective.
But I don't understand, Heather, is that fluoride being so controversial, do
Mhm.
we have it, don't we have it? In a lot of regions, areas, cities have fluoride in it. How come the fluoride people that make it or that promote it are so successful, so active? Is that a big money deal, or is it, is it
All of
because
the money.
all about
Yeah,
money, right?
it is because actually I think it was Edward Bernays back in the 30s. Fluoride is basically a byproduct of your phosphate mine. So if it was not dumped into your water supply, it would have to be labeled as hazardous waste. That's not a conspiracy theory. You can go do your own research on it. So, it's been promoted as such a wonderful health benefit. But technically, when you drink fluoride, it's only supposedly going to benefit children up to the age of 6. Your teeth are already developed after the age of 6, so it would serve absolutely no purpose for anyone that doesn't have developing teeth. And it's kind of like drugging the masses. Anytime you give a drug, it should be based on what are you seeing clinically, what's going on. It should be an individual decision. You shouldn't just be dumping it in there and saying, it's good for everybody. Isn't it wonderful? It gets stored in your bones. That's not the case. I don't want drugs that I don't need. I mean, do you?
No. so,
Right?
but I wonder about Heather. How come they are so powerful in producing fluoride? And most people are probably like me, that don't fully understand what it is, but it is obvious that it is controversial, but it is incorporated into commercials on CNN and all the major networks that are costing a lot of money, and then the healthier community. Because the question that you asked me, and what you said, I want to have healthy stuff. Do you? Obviously, I do, and so do virtually everybody these days. But still, they are powerful enough to make
Mhm.
it still even now an issue that I would say we have to stop it tomorrow, not later, not maybe, no, tomorrow. No more fluoride, blah, 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 instead of the healthy products that we're going to use. Why is it so? Is there that much money to be made? And the
Absolutely.
man,
If you look at the American Dental Association and all of these, it's cheap, right? I mean, it's super cheap. It's a chemical. So you have systemic fluoride and you have topical fluoride. So your topical fluoride is like your sodium fluoride, which is pretty much in your toothpaste. When you go to a dental office and you get a fluoride treatment, it's usually a higher grade of fluoride, and there's just different levels of it, basically strengths. But again, it's something that it's not it's not necessary. Fluoride is not an essential nutrient. There's no one on this planet that has a fluoride deficiency because it's not a nutrient our body needs. So, I think we just again have to change the paradigm of understanding what are our teeth made out of, hydroxyapatite crystals, what helps support the bacteria in our mouth that can help your body fight off decay. I mean, decay, John, is the number one disease in the world, so it's a disease. It's not normal. It's healthy tissue that has disease in it. So the problem is, here in America, 100 million Americans don't go to the dentist every year, nor do they brush their teeth even twice a day. People wait till they feel pain. And you can't do that with teeth because you'll never feel a cavity, John, when it's in the enamel. Enamel has no feeling. You're only going to feel that cavity when it hits the nerve of the tooth.
yeah.
That's when you realize that you have a problem. But guess what? Now it's too late to fix it. Conventional dentistry will tell you need a root canal and a crown. Personally, I don't believe in root canals. But instead of having it fixed preventatively for say $300 US, it's a $3,000 plus problem because you waited. And with gum disease, your bone, which is holding your teeth in place, has no nerves, so you don't feel that your bone is rotting, head rot. But the signs and symptoms are bleeding, which yes may be common, but it is not normal. So bleeding is not normal, either when you brush or floss. Sometimes a bad taste or odor in your mouth, but you can't not go to the dentist, not brush your teeth, not floss, and think that you're going to have a healthy mouth. That's a total misconception.
So, like for me, that is fairly proactive in a lot of stuff. But fortunately, my wife does a lot of reading, is very proactive in understanding. You have to be in healthcare and all the things around your body. You have to understand and being proactive. And
Mhm.
then for me, it took a while. It was in 2008. I had a case of diverticulitis that nearly killed me. Actually, it ruptured, and they had to take a piece out of my colon. And so that kind of gave me a message in 2009 that being healthy, fit, diet, exercise, I should pay more attention to it. I did some. I was not abusive, but I was one of those guys that, uh, at every year end, I'm going to do this, that, and the other thing is I'm going to buy a membership to the gym, and then 2 weeks later I can find 100 reasons why I'm too busy to go to the gym. And so I knew then that I should listen better to my wife that is so proactive in all these issues already then, and on food, and then also go to the gym, get a trainer, because my life is, I'm not trying to be important, but it's all different appointments on and on. I need to have an appointment. If I get an appointment, I go there. And so I started going to the gym, and so by then I was already I was 69 then. I was born in 1940. I started going to the gym with a trainer, and after doing that, and I gave it everything that I knew it was important, because I nearly came that close to not making it through that diverticulitis issue. And after 6 years, somebody said, going to the gym, "Hey, John, have you ever thought about competing?" And I said, "Me?" By then I was in my mid 70s. And I said, oh, why not? And so I did. And in 2017, 2018, I competed in bodybuilding and physique. Northern BC came in second in bodybuilding, third in physique. Then provincially did the same. That qualified me for the nationals and the Arnolds. And so then COVID came in, and now again I'm training. I will be 85 in November. I'm again training for the Arnolds next year. There's a picture of me here, living young, dying old, and so you know, the point that I'm trying to make is this one: is that it took for me coming that close to not making. The doc said to me after the operation in 2008, he said, "You came that close." And so then I started to look at diet, and you know, so although my wife is very proactive, I was marginal, and so I respected her for that, but I didn't believe as much as she did. Now I do all the shopping. If I go to a grocery store, I go through the outside because all the preserved, all the protein, all the food in the aisles, you know, has all kinds of things in it that I don't know, don't understand. So stay away from that, and we just deal with the you know, greens and all the healthy stuff, making sure that it is organic and being very proactive. And so
That's so important.
and so what I do now is that I still go to the gym. I'm not trying to be an Olympian or a bodybuilder or blah blah blah, but it motivates me to go to the gym, and I like it. I enjoy it, and obviously it feels good. At the same time as diet, I'm much more proactive in it. I make sure that I understand it. It was not until recently, about 2 months ago, that my wife said I had bought. She buys me toothpaste, but it doesn't have any taste to it because it is healthy, and I like the taste of toothpaste in a way. But she says, I don't want you to use that toothpaste because it has fluoride in it. I said, oh well, but I'm not going to use it now anymore. So
Right.
why is it then, is the question, that your mouth, for all the reasons that you already indicated, is such an important part of your body, if one of the most critical parts of your body, that unless you are proactive, understand it, why it is important, what you should do about it in terms of being proactive for all the reasons that you indicated, why is it so slow? And why is it, appears to me, dental care that in a lot of cases, you know, you have to pay for it unless you have an employer that is as a part of their plan. But a lot of times, proactive and preventive dental care is not very common. It's, you only go when you have a problem, and then
Yeah.
you go reluctant for all the reasons that you said. It's then already too late to fix it, and then it
Yeah.
becomes, it's a bit, I don't like to say this, but it's a bit of a racket, it appears, because the most profitable part of dental care is putting in crowns, because that costs for, or putting in stem, and you know, you can explain it, you know, where it's
Yeah.
so
There's this huge gap, I think, in understanding, we have our medical stuff, right? You go to the medical doctor, you have a primary care, but there's the mouth, and people don't seem to think that the teeth are important. Oh, it's just my teeth. I'll just have them all pulled. Well, we can amputate a limb, we can make you prosthetics. Is it ever the same? We are amputating living tissue out of your body. Okay, there's always consequences to that. And because the mouth is the gateway, so if you have bacteria, if you have a gum infection that starts as gingivitis, which is inflammation of the gum tissue, if gingivitis gets worse, it can progress into what's called periodontal disease, and that's disease of the bone where you start to lose the bone that's holding your teeth in place. That's really a struggle for the rest of your life to keep your teeth. But if you have active disease going on in your mouth, there's like 11 different bugs, John, that cause that bone to rot. 11. Two of them, one is called the AA bacteria and the other one is the PG bacteria. If you have them over threshold, in other words, if they're really proliferating inside your mouth, it can cause heart attacks, strokes, diabetes, pancreatic cancer, colorectal cancer, Alzheimer's, and dementia. The AA and the PG specifically are the most virulent and very hard to get rid of. A lot of times you end up needing even like an anti-parasite medication because some of the bacteria is actually parasite related. The Entamoeba gingivalis, I believe, is a parasite inside the mouth. So, we tend to just say, well, my insurance only covers, X, Y, and Z, so I'm only going to do what my insurance covers. But insurance benefits have not increased since the 1980s. You still have $1,000 to maybe $2,000 of dental coverage, at least here in the States. So one crown, John, one is about $2,000. So if you're somebody that has like a lot of dental work that needs to get done, that you can't rely on dental insurance. It's honestly more like a discount plan. And so that's why really prevention is key. It's just like having a vehicle. If you never took your car in to get an oil change, you never put oil in your car, you're going to blow the engine. That's an extremely expensive repair that had you just done some maintenance, you wouldn't be in that position. So I try and relate that to the mouth, because if you're somebody that has gum disease, your oral microbiome is changing every 70 to 80 days. So you really need that 3-month cleaning to stay on top of it and remove all of that bad bacteria that's harboring underneath the gums so it doesn't get worse and out of control. But gum disease is not a death sentence. I feel like people think, oh, it's just, my parents had it and, runs in my family. Kind of like the same concept as saying, well, heart disease runs in my family, but if you eat right and exercise, your chances of developing that disease are a lot less, right? So getting to the root cause, I think in dentistry, root cause issues are not addressed. The number one cause of cavities is actually dry mouth. That can be medication induced, open mouth breathing through your mouth, which you should never do. So that's really the number one cause of cavities. And if your saliva drops below that 5.5, that critical pH level, that's where those acids come in. So how you get a cavity is when plaque, which is part of everyone's saliva, mixes with anything that has even sugar in it, which ketchup has sugar. Those two things form an acid, and that's what erodes away at your healthy tooth, making it soft and sticky. So then when you're drinking acids and your saliva is already low and you're, exasperating that problem, you're going to have a rampant decay issue. So that's why we really need to evaluate how they're breathing. If someone is breathing in through their mouth as opposed to their nose, that's going to be a significant problem. But I think so much in dentistry, we're really not looking at the bigger picture. It's always, well, you need more fluoride. It's not, maybe they have an MTHFR mutation. Maybe their diet really needs to be adjusted. If you're eating ultra processed foods, you are what you eat. So you need to make sure you're getting the right nutrients, the right diet, your home care. Obviously, home care is important. But if you have like a bacterial infection going on in your mouth, that needs to be addressed. So I'm all about getting to the root cause. And in my book, Dentistry Made Easy, I go through chapter by chapter, everything that you really need to know to be your own advocate and figure out what's going on with your body, because what works for one person may not work for somebody else. So that's why it's just so important to be your own health advocate and, do your own research on things. But I really hope people, at least if they can take away one thing from this interview, is really start looking at their oral health and not allowing insurance to dictate your treatment, but being proactive about it, doing things to prevent it, understanding the oral microbiome and how delicate it is, removing the products that disrupt that, which fluoride does disrupt your oral microbiome as well. It also is a corrosive agent to implants. So, if you're somebody that has titanium implants, you don't want to be using fluoride-based products either. But really just teaching people the basics, the importance of it, and hopefully that they'll be more motivated to take care of themselves better.
Now, the other part, Heather, you are also an author, obviously. You reference to your book, and I see it sitting to your right. Can you just pick it up and show it to us, the
Sure.
book? And so that so when did you write that? That tells everything about dental health right from the beginning to how can somebody become a understanding, then become proactive and kind of look at themselves in terms of not only themselves, their children, is getting to understand the process and the importance of dental health to not only to your teeth and your gums and everything in your mouth, that it is a critical part of your body that
Hmm.
could adversely affect everything that you do.
Absolutely. Well, I wanted to make something that would really help people be their own advocate because, I mean, they see the white coats, right? And they know nothing about whether or not the diagnosis being given to them is true. I mean, how do you know if your dentist came in and said, John, you've got 5 cavities? How would you know what he's saying is true? Right?
Yeah.
I mean, would you know? So in my book, I literally teach you what to look for. I have x-rays in there that show you, look, here's a picture of a good filling, here's a bad picture, right? Here's a good crown, here's a bad crown. Here's bone loss, here's healthy bone. And just teaching people starting with, tooth numbers because if you come in and you're educated, you can have more of a better discussion with your provider. And you don't always have to make a decision right then and there. You need to really do your research about stuff because people think that, oh no, I need a root canal. I don't want to lose the tooth. You need to do your research on root canals. That is the standard of care in dentistry, but it's the only medical field where we are leaving dead tissue in a body, the only one. And it's like, okay, it's not okay. Root canals fail a lot of the time. If they can make it 8 years, that means it's successful according to the American Dental Association. But when they remove the nerve, the blood supply of the tooth, it's usually with bleach. So they flush the area out with bleach, which only can remove 44% of endotoxins, John. That means the rest of that bacteria is sealed in your bone. And because there's really no blood supply there, it's like a ticking time bomb. Now, that might not affect some people, but other people, you never know what that threshold of your body is where it can only take so much before it starts to break down. And why are we not looking at the mouth? I mean, cardiovascular disease, right? I mean, the bacteria in your mouth gets into your arteries. It can clog your arteries. When was the last time a cardiologist asked somebody, "Hey, when was the last time you had your teeth cleaned?" I mean, the two just like seemingly do not go together. It's a completely separate compartment in their minds, but it should not be. We need to really be addressing this holistically. The body, there's no fence from here to here. We need to
Right.
start addressing what's going on. So I know Dr. Joseph Eisels, he was a German doctor. I think he practiced into the 80s. He would work with women that had breast cancer. And any time that they had a root canal tooth, he would make them have that tooth removed. He would not work with them unless they had that taken out. But the thing is, you don't want to just have that pulled by like a conventional doctor because it's going to leave the ligament in there, almost like a woman giving birth and not getting the placenta out. The tooth has like a placenta around it that, if that tooth is infected, needs to be removed. If it's not removed, John, it creates what's called a cavitation site, which is like dead bone, and then your brain doesn't send the signal to your body to repair that area because it's still thinking the tooth is there. So that's what creates the dead bone. And you need to have it done properly, which again in my book I talk all about holistic dentistry, biomimetic dentistry. Just if you have a root canal tooth, you have other options. You don't have to get a root canal. You can do a ceramic implant, for instance. It's not titanium, it's ceramic. It's more recognized by your body. It's nothing metallic. Um, you do have options, and that's what I teach people in my book is what are your options? What you can do to replace that tooth and give you some things to think about because you really need to be educated. I mean, so many people just have no idea and say, well, my dentist said I need to have 10 fillings done. Well, how do you know you have a cavity? Did they show you? Did it stick in the tooth? You know? So I really I hope to empower people to make that decision because people usually don't go to the dentist for fear or for finances.
Exactly. Now, in a lot of cases, again, making reference to my wife, that was very proactive, and that with fillings that you may have in a tooth, they used, still using maybe, that the fillings are not good for you, that the type of material they put in there. What was that all about?
So it used to be that amalgam is mercury, right? That used to be the standard of care in dentistry. Thankfully, that's pretty much gone by the wayside. We do mainly composite now, which is a white filling material and doesn't contain the obviously heavy metals. But when you have mercury fillings inside your mouth, anytime you eat or drink something that's like hot or cold, that tooth is constantly expanding and contracting, which will create cracks in your tooth. So, usually, what ends up happening is people that have had a bunch of silver fillings, it's really over 50% mercury in their mouth, the tooth will start to crack, and that's why they end up needing a crown. But when they drill that mercury filling out, you are exposed to the vapor, which you're not going to smell. It's completely odorless, but it's so toxic. And that's why, again, in my book, I talk about look, you really want to consider going to a mercury safe dentist for removal because they have the HVAC system. They'll put a rubber dam in your mouth. They'll make sure that you are exposed as little as possible to toxic mercury. I mean, you remember the thermometers, right, back in the
Yeah,
day.
yeah, yeah.
If one broke in a hospital, they would send in the hazmat people and close down the whole floor because of the mercury. So the fact that it's inside of our mouths and every single time you have something hot or cold, you're releasing mercury vapors. How close is that to your brain? So I have a whole chapter on mercury fillings and where it came from and kind of break down exactly what you need to do, how you can detox yourself from having mercury. But yeah, there's so many things that we just don't even think about. If you're using something that contains hydrogen peroxide in your oral care products and you have a mercury filling, you're leaching mercury into your bloodstream by using hydrogen peroxide. You don't want to do that. I'm not a hydrogen peroxide fan in the mouth because it's like a broad spectrum antibiotic, and again, we have a delicate balance in that oral microbiome, so I'm not all about wiping it out with broad spectrum antibiotics or any kind of solution that's too powerful. But small doses, it can whiten the teeth. We don't want to be used. You had mentioned earlier about whitening, teeth whitening, and there is a misconception I want to address for people. It's not how hard you brush your teeth, and you don't want to be using really abrasive ingredients inside your toothpaste. Like never use charcoal. That is so terrible for your enamel. You only have one coating of enamel, John. You cannot regrow enamel. You can remineralize it, but you can't regrow it. So you don't want to be using things that are going to strip away your enamel. So my toothpaste, actually, I had it tested because anything over 70 is considered abrasive, which Sensodyne is a big sensitive brand toothpaste here in America. Sensodyne's between a 72 and a 79. I think their Pro Enamel is less than that, but my toothpaste is like a 31 and a 32. So it's extremely low abrasive. It's going to be safe for your crowns, your enamel. It's not going to scratch anything. I don't even like hydrated silica. What is silica? It's like sand. So you're wearing away at your enamel, and like I said, you cannot regrow it. So it's so important to protect it, which is why you want to use things that are, supporting your enamel, helping to naturally remineralize it. A number one mistake people make is they brush their teeth immediately after they eat. You don't want to do that because your saliva is your natural protectant. So you want to wait 30 minutes before you eat. Before you brush your teeth. So that way your saliva is doing what it's supposed to do. But baking soda is the most mild cleanser that you can use, John. It's a 7 on that scale. So if you feel like you're getting some stains, you can use straight baking soda, which my toothpaste is also baking soda formula and coconut oil. So, you want to remove stains, but safely. And the only way that you're really, really going to whiten teeth is through your bleaching agents, which whiten the tooth from the inside out. All something abrasive is going to do is kind of remove the surface stains. If you're looking to completely change the color of your teeth, you need a veneer, which is a thin porcelain facing, or you would need to whiten your teeth with the bleaching agents to get them whiter overall.
So interesting. Now, a couple of questions. Now, somebody that had dental care, like somebody like myself, probably I'm nearly 85, but a lot of my dental work was done when I was younger, 20, 30, 40 years ago. The likelihood is any fillings would have been mercury
Mhm.
related, and so does that remain to be active in your teeth? I've known people, including my wife actually, that had her and implants removed and replaced with something different. That
Mhm.
so the
Yeah, well,
question is that I have in my teeth that were done 20, 30, 40 years ago maybe, is that still active? And should somebody look at potentially replacing it, or is it what should one do?
I would remove it. I mean, heavy metals are serious, and I've never actually had a cavity in my life. So part of my frustration with dealing with my daughters was that we did not vaccinate our children. We made all of their own baby food. They were breastfed. And Olivia, my daughter that had all these food allergies, was still extremely sickly. I had her tested, and she tested positive for heavy metals. That came from me. I'm breathing in vapors as I'm working in dentistry. All of that mercury is being vaporized and I'm breathing that in. So that came from me. So I'm constantly having to detoxify myself from heavy metals, and I don't even have any mercury fillings in my body. So, a hair test is really a good way to see kind of where you stand with that. But I would work with a biomimetic dentist because they're going to only remove as small amount of your enamel as possible and keep your tooth, the structure of your tooth intact. So your teeth, the way that I describe it is our teeth poop, right? Every single day. So brushing gets off 60% of the poop. It's the smooth surfaces. But the rest is in the toilet bowl. And that's the space between your tooth and your gum. So the only way to really remove that is with actual manual floss. You really have to be removing that. But because our teeth are detoxifying, we don't necessarily want to put a full coverage crown on that unless that's absolutely necessary, because then you're kind of blocking the way that the tooth detoxifies. So a 3/4 crown, and again, I talk about this in my book. You want to preserve as much of that tooth structure as possible, which is why I like working with a biomimetic dentist. They're just gonna, do what they can to preserve as much of your tooth structure as possible. But I would definitely recommend having root canals addressed, mercury fillings addressed. Sometimes people have had like these chronic health issues that no matter what they've done, they've never been able to get over that threshold. And I'll ask them, well, have you gone to like a holistic dentist and been evaluated? Have you had a cone beam to see what's going on in your mouth? Do you have some cavitation sites? Do you have root canals? So I think hopefully people will start to change their thinking and start addressing the root cause instead of, saying, oh, well, my insurance, I have no insurance, so I'm not even going to go.
What concerns me, Heather, is this. In Canada, likely similar, we are so similar, US and Canada, in terms of what we do, healthcare, medical, blah, blah, blah. We have similarities. is that finding medical doctors here in Canada, very difficult to get medical doctors. And a lot of people have no medical doctor. I grew up in a time in Holland when it was totally unheard of here that if somebody in my family, my mom or dad or whatever, needed a dog, they called the dog and he came to the house. Well, we're far away from that here today, that a lot of people have no dog here in Canada, at least, and maybe there are similarities with the United States. So that then being said, that the same and medical doctors are not being taught preventive maintenance, if you will, repairing it to the car. What can I do to become more conscientious about the food that I'm putting in my body? And so that means that I said I go shopping on the outside of the store, because in the aisles is all processed or super processed food that has likely something in it in the small lettering that's not good for me, so I don't even go there. So so that's the one. The same with that. If you and me were, hypothetically speaking, dentists together, set up a business that is basically wants to make money, and be conscientious, because that's what we do. That's why we're professionals. But at the same time, we have to be profitable as well. So if we teach people too much of not using us, then that's not likely good for our business. At the same time, so what can we do to make sure that we still have a business, and that, so are we now I believe what is happening now, hence my book. It's age is just a number, but I say how to thrive in your mid 80s or 85, like my case, that is me. But the thing that's even more important about the picture is not so much the picture, but saying that, thanks to my wife to a certain extent, and becoming more conscientious, I want to say, I believe I need lots of vitamin D in some form or fashion. Sunshine is good. I sleep between 7 and 9 hours a night. That's good. I'm going to be conscientious about diet. I go shopping and I like greens and, organic. I need to understand what is in it. I stay out of the middle aisles. And then at the same time, I go to the gym, in my case, very proactive, because that's what I do. But I say to anybody, move your body in some form or fashion, and then add to that strength training as well if you can, because as you get older, then it becomes delicate. You have to make sure that you do both. And they say, well, I know lots of people, they are, I started when I was in my early to mid 70s, and where I'm still now going to the gym and doing all the other things. And people that are in their 40s or 50s say, well, I'm too old for that. I'm too this and that. So no, you're never too old. That. Right. What it is all about is quality of life. Absolutely. That's what it is all about. So being proactive in that mentally, that's important. My foundation is attitude, passion, work ethic, but will follow is success. But at the same time, understand your body, because it's the only body that you will have in this lifetime. The likelihood is, if the average is that the last decade of their lives, they're struggling with all kinds of diseases, and they have hands full of chemicals that try to suppress it. And so that, for me, what is important, hence the book is saying it's about quality of life. And at nearly 85, I still get up in the morning at 5:30. I'm very, very busy. I have all kinds of different companies. It's not about that, but I'm very, very active. I'm an author. I've written 6 books and working on more of them. And then Obviously, I'm a very active podcaster globally, and you know all about that. And so I enjoy every day of my life, but the foundation is likely, partially thanks to my wife, really, in spite of myself, and then being proactive in these kind of shows that we're doing with yourself, that has been an authority in this field in particular, and showing it globally as to how important it is to understand being proactive
Yeah.
physically in the parts of your body that are so critically important, that give then longevity and quality of life, which is the most it succeeds everything else. It's not about money or making more money and more money, but it's about quality of life. And then that is every day when you get up and saying it's a beautiful day, and it's every day then is precious. To me it is. I look around and I say I'm in paradise. And if I do a lot of business in North America and in the States as well, fly around a lot. A lot of times I sit by the windows, I look outside and say it's paradise. But a lot of it has to do with understanding your body, staying mentally active,
Well, you
and
just said it right there. It's your mindset. And you remind me so much of my dad. I just got to give him a shout out because he's a professional power lifter. He's 78. He's number 13 in the world. And he does this Russian training program. He's so dedicated. But I would say he really played a big part in my life with the whole natural thing. He's always been such a good example when it came to exercise. He's extremely mentally strong, very positive thinker. He's extreme in his food choices, I will say that. But Dr. Weston A. Price kind of was the first to discuss focal infection and health and how the foods really impacted entire cultures. He would actually go to islands that had never really been, I think this is back in the 1930s, that hadn't even been really developed yet. And he would study their jaws and their teeth and the crowding, right? The crowding, the vertical jaw, that was more in the US than abroad. And so he was like, what's going on? What's the root cause here? And in these other cultures, their jaws were wide. They had beautiful white straight teeth, healthy, no disease, no cavities. Is the diet is so important. Animal fats, so important that getting that right nutrition for our cells. If your body isn't getting enough vitamin D, it's going to pull it from somewhere. As women, we tend to lose bone more than men. We only have until we hit menopause to be building bone. So it's so important that you are getting the right supplementation so that you're giving your body what it needs. If your body isn't getting what it does need, it's going to break down somewhere, right? So yes, mindset, so important. Our thoughts dictate our life. Food, super important. Being regimented, exercising, you have to exercise your jaws, chewing hard, crunchy foods. This is very, very good for your teeth and your jaw health. If you have nothing but a soft liquid diet, I mean, things atrophy over time. So, I think it all plays such a part in holistic health. And it's a big picture. It's not just doing one thing. It's, evaluating your body is a temple and what you can do to make that temple as great as you can on this side. I know for myself, I'd like to be like my dad, who he's going to be 79 this year. He's on like maybe one medication, maybe two medications. I mean, he's in incredible health. Um, he's a little skinny, but he's extremely lean, extremely fit, and I
what's his first name?
George Getz.
George. Okay.
George Getz, yeah. He had
Is
an
he?
injury which
Is,
prevented him from competing, but he's going to be competing, I think, in another couple of weeks to get back into doing some national competitions.
I hope he's gonna watch this podcast that you and me are doing, and so I'm gonna send you copies of. I have 4 books right now. One is coming, and then another one is coming out in June, and then I'm working on the next one. So that has been important. So I'm gonna send you copies and sign them. And send them to you, and then show us once more your book that is available on all the major areas, Amazon, on and on and on, and all of those.
Yeah, you can get it on Amazon. That's probably the easiest place to get it. You can either download it or buy the physical hard copy. I do have another book coming out. It's more contrarian. It's called The Great Tooth Deception, Revealing the Dark Side of Dentistry. And I really get into what happened with fluoride, why we are where we're at
I
today.
I like that, very timely, I believe, Heather, and so I don't know, when is it coming out?
Next month. Next
Next
month.
month. Okay. So I'm going to mention to Scott to kind of we should get together again maybe for another podcast in
And
the
I'm
next
happy to
four or
send you
five
my
months or so.
wow, that would be fantastic. And I'm of course going to send you a care package with some products.
I like it. Show us once more the other product that you have there next to you as well.
So
So
I
tell us
have
about that as well.
this is my spearmint. This mouthwash has nano hydroxyapatite in it. It's extremely alkalining. So I would say people usually fall into a category of either cavity prone or gum disease prone. I feel bad for the people that fall into both, but usually it's one or the other. So I've never had a cavity, but I tend to build tartar like nobody's business. So I use more of the products for gum issues, which I have a mint and a cinnamon that would be more considered for people that have gum disease issues. But this spearmint is great for if you like mild spearmint flavor. It's not overpowering. It's not going to burn. There's no alcohol in it. But it does contain nanohydroxyapatite, MCT oil, xylitol, baking soda, things that are going to remineralize your teeth and help support that oral microbiome. And then my toothpaste, all of my toothpaste does contain nanohydroxyapatite, but what makes mine different is that it's actually an oil pull as well, because the number one ingredient is coconut oil. And so coconut oil has been an Ayurvedic way of oil pulling for centuries. It naturally is an antibacterial, anti-inflammatory, helps to whiten teeth on its own. So it's a fantastic ingredient. Most toothpaste is water-based. Mine's coconut oil-based, and mine is also raw. We don't heat it to the point where it kills off all of the good beneficial ingredients. And in my book, I also discuss all the bad ingredients you want to look for in your oral care products, a whole list of them. But when you use my products, they're I know what works and what doesn't work. I mean, I'm in the trenches literally every day. So you can find really whatever you need on my website, simplysilvermouthwash.com. I have 3 mouthwash, 3 toothpaste, 2 breast spray. And I am coming out with a skincare line called Simply Tallow because, our skin is our largest organ. And what we stick on our skin is also being absorbed into our body. So I'm just all about ditching the toxins, and
Yeah.
I don't want to eat chemicals. I don't want to put them on my body. I don't want to brush my teeth with them. So just trying to detoxify my life as much as possible. And, hopefully, like I said, people can be overwhelmed at first, but I would just always encourage them to make one small change at a time. Throw out that commercial toothpaste, use something natural, and just kind of go from there, but become educated and informed, and hopefully that you'll make some better decisions when it comes to your oral care.
So give us your website. How do people contact you?
Simplysilvermouthwash.com is my website, and
Okay.
then my email is I'm so sorry, somebody knocked on my door.
No worries. No worries. We have dogs too. That's all part of it. So, yeah. No worries.
Bad. But my email is heather@simplysilvermouthwash.com. So they can reach out to me via email or, like I said, directly through my website. I do consultations. I do dental consultations. I do orofacial myofunctional therapy consultations where we evaluate the airway and kind of get to the root cause of why someone may not be able to nasal breathe. Again, we don't even touch on that subject, but Um,
So now, if people that are older, sorry, interrupting you a little bit, I'm just trying to stay in the timeline, is that it doesn't matter what your age is, there is never too late time to start with healthy and being proactive. That you, you can be my age and saying, okay, that's what I'm going to do. I'm going to go in a new direction because I like what you're doing, and I like being proactive, understanding it, non-toxic, and all the other things. It's all part of living young, dying old, as my book says. Quality of life and longevity is the most important. And then whatever you put in your life, on your skin, on your teeth, is all helps towards that, because it is all connected to the rest
Absolutely.
of your body and being healthy.
Absolutely. I couldn't agree more.
Heather, it was an amazing podcast. Went by far too quick. We'll set up another podcast with you probably in the next 3 to 4 months, 5 months. I'll get Scott to stay in touch with you. I'll sign the books for you and sign
Well,
them, show them to George, your dad, and also an amazing individual, and
yeah.
say hi from him to me, and as he watches us. And for all those people watching us from around the world, is saying this is another podcast again that deals with issues that are so important to all of us around the world, being proactive, longevity, and quality of life. And Dr. Heather again added to this something amazing. And so if you like a podcast, you want to see more like it, become a subscriber, share it with others, like it if you like, and comment, and contact Dr. Heather Paul. Heather,
Well, I'm not a doctor. I'm a
so
hygienist, but yes, thank you.
hygienist, and sorry you said that.
Okay.
Correct. So thanks, Heather, for the podcast. We really enjoyed it.
Thank you so much for the opportunity.
Thanks, Heather. Take care.
You too.
Bye bye.
Bye.